This large-scale matched cohort study investigates the long-term association between burn injuries and mental health hospitalizations over 33 years. Analyzing 23,726 burn patients and 223,626 controls from Quebec, Canada, the study found that burn survivors had a 1.76-fold increased risk of mental health hospitalization compared to controls, with risks persisting up to 30 years post-injury. Severe burns, greater than or equal to 50% body surface area, third-degree burns, skin graft requirements, were linked to higher risks, HR 2.00 to 3.29. Notably, burn patients exhibited elevated risks for eating disorders, HR 3.14, substance use disorders, HR 2.27, and suicide attempts, HR 2.42, particularly within the first 5 years after injury. Comprehensive data linkage, utilizing population-based registries allowed for accurate tracking of hospitalizations and covariates, including socioeconomic status and pre-existing conditions. This reduces selection bias and enhances generalizability within publicly funded healthcare systems. Subgroup analyses, detailed stratification by burn severity, e.g., body surface area, degree, graft requirements, and mental health outcomes strengthens the validity of associations. For example, severe burns requiring grafts showed a 2-fold higher risk of hospitalization, highlighting the dose-response relationship between injury severity and mental health outcomes. Comparison with recent studies, short-term versus long-term risk. Earlier studies, e.g., Bitch et al., 2021, reported elevated psychiatric risks up to 5 years post-burn, while this study extends the timeline to 30 years, corroborating longitudinal data from Abouzide et al., 2022, on chronic mental health decline. Severity gradient. Consistent with Logsetti et al., 2016, severe burns requiring grafts showed the highest mental health risks, emphasizing the need for targeted interventions in this subgroup. Substance use disorders. The observed 2.14-fold increased risk for alcohol-related hospitalizations aligns with Mason et al.